So atenolol is a very important medication to know. The second you hear that name, you're hearing the OLOL, and I know you're already thinking of beta blockers, right? Beta blockers are very important to know because they come into play with the sympathetic nervous system. And as you understand the sympathetic nervous system and how beta blockers work, you're going to understand a huge gamut of diseases as well as medications, and you're going to understand really a lot about how the body is working. So generic name is atenolol, trade name is Tenormin. Indication is hypertension, angina, prevention of MI. So with these beta blockers, you're understanding that we're talking about the heart. Okay, so what it's really doing is it's blocking the stimulation of beta 1 receptors in the sympathetic nervous system with minimal effect on beta 2 receptors. Now, what does that mean to you? Beta 1 receptors are mostly in the heart and in the blood vessels. Beta 2 receptors are mostly in the lungs. And so as you hear beta 1 receptors, and a good way to remember that is beta 1, you have one heart, okay? And so beta 1 receptors are going to be mostly in the heart and the vessels. Beta 2 receptors, you have two lungs, so beta 2 receptors are going to affect the lungs mostly, and they're going to affect that portion of this fight or flight system. So what it does, it really antagonizes or blocks stimulation of beta 1. Okay, so we think fight or flight. Okay, when our fight or flight system gets all excited and everything, and it's time to fight, it's time to flight, so our heart starts beating fast to try to get us working harder and everything like that. What we're doing when we antagonize that beta 1 is we're not allowing the heart to beat so fast. We're relaxing the vessels. And that is what really is occurring with this atenolol. Okay, as we antagonize beta 1, we're helping with that hypertension. We're helping with that angina. We're preventing the MI there, okay? So therapeutic class is anti-anginal or antihypertensive. Pharmacologic class is beta blocker, and we've talked about that already. So some nursing considerations, it's contraindicated with CHF, it's contraindicated with pulmonary edema, cardiogenic shock, bradycardia, or heart block. Now, a lot of these beta blockers, these beta 1 blockers are going to be contraindicated with bradycardia and heart block because as we give these, we're going to kind of slow that heart rate down. And so if our patient already has, a heart rate of 45, we don't necessarily want to give a beta blocker if it's going to affect the heart rate. It's also going to be contraindicated with heart block because within our heart blocks, right, we have a delay in the transmission of our signal, right, in our AV node. And so a lot of these beta blockers are going to work right in that area in the AV node. And so if we affect that, we could lead to progressing this heart block even worse, okay? So we're going to want to monitor our hemodynamic parameters, our heart rate, our blood pressure, and I really want you to be checking your heart rate and blood pressure prior to giving these medications. Not like 4 hours prior, not even necessarily an hour prior, but right before you give it. Now, working in an ICU, that's pretty easy for me because my patients a lot of times have art lines, and so I have continuous blood pressure monitoring, and I also have EKG monitoring, so I know exactly what's going on. But if you work on a med-surg floor or you work in a doctor's office, I want you to go ahead and check blood pressure, heart rate before giving these medications. You really don't want to give it to a patient and plummet their heart rate. Again, it can cause bradycardia, CHF, and pulmonary edema. That's why it's contraindicated in these. It's going to mask symptoms associated with diabetes mellitus. So that's one thing associated with beta blockers that can occur is it can actually mask the symptoms of diabetes and hypoglycemia and stuff. So that's one thing to just keep in mind. You're going to want to advise your patients to change positions slowly because beta blockers can lead to orthostatic hypotension, which is as they stand up, their blood pressure really drops, okay? So you really want to have them monitor that. And you're going to want to monitor or let the patient know how to check their blood pressure, how to check their pulse rate, and how to do all those things at home so that as they go home and as they're taking this medication at home, they're able to take care of themselves. This has been another episode of the MedMaster Podcast by Nursing.com. To get your free copy of the 140 Must-Know Meds textbook, head over to nursing.com/140meds. That's nursing.com/140meds. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.